All right, that's always a criteria. So let me jump in. State of the behavioral health at Northwell. Start off with just a couple framing comments. We are in the midst of a number of different transitions, obviously in the health system. The most prominent of which is the change in CEO that takes place October 1st. Dr. John D'Angelo will be our new CEO. Michael Dowling will remain as CEO Emeritus. He has expressed multiple times to me and others that he intends to be very active in the behavioral health space, which is great for us as an advocate and co-champion. John, I saw John give a talk yesterday in Manhattan where he talked about the importance of mental health and behavioral health and the importance of really growing that continuum of care and pressing forward. So I think there's going to be a lot of continuity in terms of values and mission. I don't see that changing. I think you will see a different leader, obviously, with different approaches and ideas, and we'll see how that plays out over the next years. We also have a transition locally here, and president of the hospitals and SVP service line. So Mike Scarpelli, as you know, and there's an event for him this afternoon here, will be transitioning over to Syosset and Plainview, and we have Deepa Avula taking his role. And this both is bittersweet. Mike's been a great partner. We, in the newsletter last week, we talked about some of his many accomplishments. We're also excited to welcome Deepa, who brings 20 plus years of experience with SAMHSA, former state director of mental health in North Carolina and deputy leader in the mayor's office in New York City. She's got expertise in the BH space, and she's really excited to bring that here and help us grow. So welcome to her. And then just, I think it's important to acknowledge, for me in my life, I don't remember a time like this where there were so many threats and some opportunities, but to healthcare and our mission. We have HR 1 as the new law that some call BBB, and deep cuts in Medicaid. We've got an epidemic of administrative burden, rising costs. We have the rejection of equity as a value. Really an assault on the public health system, a flawed financial reimbursement system that really is driving increasing costs, silver tsunami, workforce shortages, deep inequality and inequity. So all of that combined, it's a really sobering time. I think it's going to be really important. We'll talk more at the end about how we navigate through this. And then on top of that, we've got Epic as the transition to a new EHR system-wide, and that is a huge investment that the system's made, and it's really complicated. This is the largest Epic implementation ever, and there have been some real bumps in the road. Big shout out to Inder Singh and Manish, who've been tireless advocates for behavioral health. And, we have, I think some of us are starting to do the trainings now in wave 1, and we're getting the first peek of what it really looks like. It will be better, but it won't be without its bumps, and we'll need to improve as we get experience with it. And then AI. I was just at a 2-day international symposium, top leaders from around the world in AI and healthcare and education. And there's a lot of opportunity there. There's also a lot of disruption that can come with that. And the technology is advancing so fast that it's really hard to know, where we'll be in 6 to 12 months, let alone tomorrow. But at a very basic level, opportunities around ambient scribes and kind of reducing administrative burden, I think, is high. And then at a sort of next stage is looking to how we incorporate this and help with diagnosis and treatment matching, and then obviously therapeutics and such. But that's going to be complicated, and it's hard for a big health system to move nimbly with technology, as we know from our lived experience. So all of this combined, I think it's both a lot of exciting opportunities here, but there's complexity and there are threats. Now, how do we get through this? Well, the way we get through it is having a clear mission and having each other. And, fortunately, we've got a great team to help us navigate this. Here you see our sort of senior leaders of the service line, Mike, Manish, and Greg. And then there's a lot of folks underneath this who play really important roles. We've got the department leadership with our vice chairs, Blaine, George, Victor, and Neil, and Howard, the medical director. We've got a terrific team of division directors here at Zucker/LIJ/CCMC/North Shore. And then we have our system chairs at the different sites and medical directors who are also very strong and engaged. And, this is really the group that is, going to be helping navigate us through these times. Here we are. So Northwell Psychiatry or Behavioral Health. And you can see here, we have our 8 hospitals that have inpatient facilities, the 2 largest, obviously, Zucker and South Oaks. The orange dots are all of our outpatient programs. And, we're big. We have 320 psychiatrists, over 100 psychologists, 90 nurse practitioners, and more than 130 master's level therapists. And hopefully that will grow over time. Now, the other big transition I didn't mention is we have a new member of our health system, which is Nuvance. And Nuvance, who many of whom are listening online, they bring 8 hospitals with them and their own psychiatry footprints. So Norwalk has 12 inpatient beds and an outpatient IOP, Danbury 22 beds, and then some ambulatory IOP. Sharon has a Jerry inpatient unit, New Milford, which I think New Milford is in Connecticut. I'm learning my geography. They have outpatient. Putnam is where the residency is based, and they have an outpatient program in Partial. They have a 32 residents in their program. And then there's Vassar in Northern Dutchess. So we've started the integration process with them in behavioral health. We had our first meeting up in Danbury late July. We'll be meeting, on a regular cadence. And, we're going to be working towards integration where, and this is, a map that really shows Nuvance and Northwell as one. Getting to integration is going to take a number of years as we work through, all the different levels of integration from the back end operations, the clinical strategy and such. But I think they have a terrific team that we are engaged with. Chuck Herrick is the chair there and their service line lead, currently serving as the program director. He's an amazing psychiatrist and leader. And then Liz Peralta is the administrative lead. And then you can see that they've got a strong education team with Meredith and as the APD as well as Majd. And then they have some chiefs at different hospitals. So we're getting to know them, and we'll be looking forward to working closely with them. Okay, so transitions, challenges, Nuvance integration. I'd like to spend some time transition here to how we're doing with our mission and kind of some of the key accomplishments this past year. There's much to be proud of, even in a time of uncertainty. And just starting with our overall mission is improve the behavioral health of our patients and the communities we serve. And we're familiar with this whole notion of having 4 parts to that mission, right? Patient care, education, research, and community. This is the strategy that or the framework, I should say, that we developed 3 years ago. Greg, Manish, Mike, myself, others. And this is really guiding our overall approach to how we build a continuum of care that can both improve access, but also shift care to lower cost settings and improve the quality that's delivered. In the self-directed space, we've had a couple, I think, notable accomplishments this past year. I'd point out internally, Fred Munch and Svetlana, others have developed a tool that matches a need to a low or no cost AI or digital option. So if you type in, depression, anxiety, what are some apps out there that are evidence-based and don't cost $600, every 6 months? And that's something that we're piloting. I think it's being used right now by our care navigators, but in theory, this is something that we can make available on a more broader scale. On the right is our first real experience with an actual app that's been FDA approved, Sleepio. It's got a lot of research behind it. And we're piloting it in a geriatric clinic, thanks to Blaine Greenwald and his team. And Greg has really, Bennett has been key in terms of just negotiating, the arrangement with them and working through all the IT and legal hurdles. But we're hoping that if we can figure out the reimbursement, I think Medicare is supposed to, CMS produce reimbursement rates, which we don't have yet, but we'll see, and hopefully we'll be able to start to use this app in our standard of care. Other types of digital or self-directed supports. There's a Stress First Aid app that Svetlana and Fred and others have been developing with, I think, with CTSRR and Mayor and his team, which is be a Teams, Microsoft Teams-based app that provides help identifying stress level and then real-time tips and strategies as you work with your team. And then Kids Connect. Vera got a grant, whereas Vera, I think she stepped out for there. She got a grant, there she is, to build an app that's in development. We hope to launch in this next year. And this will help with both connecting families and children to resources, as well as expedited access through our Access Center to Care. So that's the self-directed space. Integration has been another area that we've really focused on. And, this is about how we overcome, both put care in lower cost settings, but also overcome stigma and other types of barriers by placing the care close to where people routinely engage. And in this case, one of the primary examples is in medical settings. And as you know, we have a very mature collaborative care program and in pediatrics and adult primary care. And that's stayed stable this year. Where the growth is we've started 2 co-located practices, we call them sessionals in Queens, Fresh Meadows and Glendale. Thank you, Greg. And the big area of growth is OB, that Andrea Bianculli and team we're bringing on 80 plus OB practices. And this is going to be more of an expedited sort of screening and then expedited connection to care. So big growth there, and that's exciting. School mental health under Vera's leadership continues to both win awards and grow and to just be outstanding in both their prevention as well as early recognition and treatment. She and us have gone from 54 to 65 districts this past year, 300 to 410 schools, up to 275,000 kids within that scope. And we've added 2 behavioral health centers that I'll say more about in a little bit. And then another, I think, example of our work in integration has been with our faith-based partners. And we continue to train clergy in stress first aid and mental health first aid. We've sent additional clergy to get training as lay counselors. They are front lines for counseling and responding to crises and mental health challenges. And many don't have any training in that. Some do, but many don't. And so we are each year trying to send 3 to 4 to this intensive 3-month training program. We have the Clergy Advisory Council that Deb Salas Lopez and I co-chair. She has been, and her team have been terrific partners with the faith-based work. And we hosted our fifth annual Faith Leaders Forum this spring. And we also had thanks to Don Shackna and his work, the New York Philharmonic Music and Wellness Series, a second go-around of that, where the NY Phil came two times to Mother Amy Zion Church in Harlem, and then First Baptist in Corona. And we combined their music with our some input around wellness and mental health. So that continues strong and supported by, we got another grant from Mother Cabrini to continue to grow that. In the specialty care space, one of our biggest charges was to grow our ambulatory network. And I think you see some real evidence of that. It's really exciting to sit here and look at this map, and this is real. So, Mount Kisco soft launch in July. I think the ribbon cutting is coming up very soon. That'll be both a behavioral health center for our school mental health program, as well as a child and adolescent outpatient practice. Riverhead, we had this really fun ribbon cutting back in the summer. That has launched, and that has both that's the second new BH center for the school mental health program, outpatient child and adolescent, as well as the partial program, licensed under South Oaks. And then we have three, and then Manhattan, we have the East Harlem clinic that satellite clinic of Lennox that will actually do ribbon cutting next week on Monday. That's launching this month, and that's really exciting. And then two additional ones coming in the next year. Rego Park, so that's going to be a big full spectrum Stucker, licensed clinic, OMH clinic, in close proximity to both Little Guyana, which links with our global mental health work, as well as with First Baptist. And then we have in Manhattan, the 62nd Street space that we're hoping to raise the final dollars we need in the next weeks, months, so that we can renovate that space. Is what, 5,000 square feet, roughly, north 5,000-6,000 square feet, beautiful space in Manhattan. And that will be the home of both Lennox's main outpatient clinic, but also the residency program, which just started. B-Health is something that I'm not sure, has anyone here used B-Health? I see a lot of hands. B-Health is an amazing platform that we've developed, Manish and his team and Svetlana, that provides behavioral health care to particularly Northwell employees, and uses evidence-based psychotherapy, the universal protocol. Is that right? And you train around that. It's a real model, and they've got some apps and other types of things that they're developing. So over 3,500 folks have engaged with B-Health, and in 24, we had, it looks like about 250, 300 employees engaged in care through that. We have a lot of other outpatient specialty care that, with time, we don't have to go through, but just to acknowledge, John Merson stood up an ambulatory locum telepsychiatry group that's particularly been helpful in serving some of our sites when they go through difficulties with recruiting, and able to provide short-term to medium-term coverage. CBT practice at Dan Hoffman, and that's growing. We have the Center for Military Veterans Families that Mayor directs, Finest Care, which provides immediate access to NYPD officers who have experienced trauma and want to talk or need help. Neuropsychology is growing. Phil Watson, I think, it's really exciting as we've I think have a model that Greg and others have developed financially that hopefully will allow us to break even and grow that service. And, right now we just have someone now, 0.5 at Mather, which is Suffolk and Westchester are the areas. So that's terrific. And more to come there. And then Sarah Marks runs the Resident Fellow Mental Health Center here. And there's one at Lenox as well. External partners, we've already had partnerships with Valera and Charlie Health. This past year, the update is Brightline. This is sort of hot off the press, if you will. Don Shacknai has been working with Mike Scarpelli and developing a strategic affiliation that we're going to announce, I think maybe next week or maybe today. And so Brightline focuses on children and adolescents. They were an online virtual platform that's now investing in building actually brick and mortar spaces for sites in New York. So more to come on that. And then complex care, which we do, this really gets to the heart of what we do here at Zucker and really at all the hospital-based clinics that we have. Staten Island, Mather, South Oaks here, Lenox, Phelps, where folks who have experienced severe and persistent mental illness or have other types of substance use or subspecialty needs around bipolar, OCD, et cetera. And here our strategy remains the same, which is if I focus in here on the second bullet on the right, expanding existing centers. So we're focused on wanting to develop a system strategy and network of subspecialty clinics. The first two areas we're focused on is OCD. We're working on our first presence at Staten Island with Ved Kumar, who just graduated from the residency here, trained in the OCD Center, and we'll be partnering with Anthony and John. And then in perinatal, we have Amanda Tinkelman here at Zucker, and then we've got Jess Cosgrove, Aaron Daner at Mather, and we already have a program at Lenox, and those we're looking to actually start to build. So we have kind of a hub with a common approach and a team and such. And the principles are going to be, first of all, is trying to leverage these centers, build in consultation opportunities, whether that be curbside or formal, to help keep patients in more general settings because these clinics fill up really fast. So as a way of improving access to the expertise. We're also looking to, adopt top of licensure care models where possible, and to look at how we can graduate patients back to the community when they no longer need the subspecialty expertise. So that's a work in progress. George Alvarado is leading that system-wide. On the SMI work here, George and Hira Ruskin from Health Solutions and Chris Fisher, Joe Scuteri, TJ, many others, working on improving and really redesigning the care model that incorporates better care management for our patients so that the psychiatrists and NPs can do psychiatry, the therapists can do therapy. And part of that is training folks in lay counseling. And we are training both our care managers and resource associates in lay counseling and working on a plan such that every patient will have a care manager that's identified in the clinic. And I think with this, we're hoping that this will both improve both the therapist and clinician experience, but also improve access and the quality of care. And this is a really exciting partnership that is underway. And I think we've seen some of the benefits already, and as visits have actually improved and RVUs as well. Center for Traumatic Stress Resilience Recovery. We have a new trauma center here at Zucker Hillside. So joining ETP, bipolar, perinatal, OCD in college. And they are currently offering, and this is a project that Mayor has led with Aisha Hansodi, a fourth-year resident. And this has been a pathway project, and she's really did the initial groundwork and designing this, and then working under Mayor's direction and others to make it a reality. So they are seeing patients and providing evaluation and then medication management and individual therapy. And they are actively looking at developing a masked model treatment and group therapy. So more to come there. And and that could be an IOP type service. This, of course, is in addition to what already exists. CTSRR is one of those remarkable constructs, if you will. It's a real team and group of people, but they cover the whole spectrum of our framework, the continuum. And so they continue to do work in primary prevention with the stress first aid, secondary prevention with resilience coaching for folks who are in the orange or red. A lot of capacity building around trauma-informed psychotherapy trainings with different services. And then the clinical services that we've had at some of our NHPP practices, but now have at the trauma center. College remains, with kind of riding the wave of the HBO documentary, which I think highlighted just the exceptional care and program that we have and the ways that it helps college students experiencing a psychiatric crisis. Here, the big news is where we've started an inpatient unit, college unit at South Oaks. So that's been launched. I think there's a ribbon cutting last month, lots of ribbon cuttings. And we now have 96 partner schools that encompass over 650,000 students. And this program includes a post-acute outpatient with over 11,000 outpatient visits, as well as provides a really important service to the medical students at our medical school as well. Coming, Northwell College Connect, which is meant to be an outpatient expansion, really. So this isn't so much about post-acute outpatient, it's more about treating folks before they get to that point. I think we hope that we're close to being able to announce some of our first contracts for this, which would allow us to provide a 24/7 crisis line for any student at an enrolled university, as well as a full range of outpatient care. So stay tuned on that, right? No news yet. All right. And then acute care, we've had a number of expansions here across the system. Mather opened its rapid access clinic back in October. Erin Daner and her team. It's a really lovely event and very exciting and you can tell from the community just how excited they were about having this new service. Mather's also expanded their partial program from 25 to 55. We have the Behavioral Health Center at Riverhead that I mentioned with 30 spots, new spots for partial. I mentioned South Oaks College Unit. Zucker, we started in the last year, the RAC, and we have the 10 new beds in Kaufman, which are now live. And Dr. Greenwald re-established the partial Jerry program. And then the final area of growth here is we got funding. I think this was through a state grant, COE, for a child and adolescent ERGI ED, or it's not ED, but ERGI clinic at Staten Island. And Rashi Agrawal, who's relatively new chair there, and her team have launched, and that's fantastic. We have two big capital projects, or one is this big hole in the ground over there. It's gonna be 100,000 square foot hospital, 68 beds. And then on the left is we're fundraising for a state-of-the-art child and adolescent behavioral health pavilion that will be connected to Cohen's and Zucker. And that there's been a lot of effort and work around that in the last several years, and I think we're getting close to $100 million raised for that. So we're getting close to our target. That's really exciting. Now, once we do get the money secured, the fundraising, it's going to take some time for that thing to both get designed and then obviously built. I think there's no way of predicting, but maybe what, 5-10 years? Five-ish? 5 years. All right. 5 years. You heard it from Greg Bennett. Ish. Now he's caveating. That's what you learn in college. It's always the caveat, right? Everything. All right. So virtual access hub. Manish and his team with Megan Grela and George and Bianca. This idea of having no wrong front door, single point of access. It's real. It exists. You talk to a care navigator, you get personalized options and then appointments made, and the care navigator can provide support until the contact's made with the first appointment. 2,200 patients so far have been served through this. And we're really excited about this, I think, and we're excited about what's going to come, which is really, we'll call, the Access Hub 2.0, which is starting to layer in AI and other more advanced technologies to help with initial diagnosis or potential diagnoses, treatment matching, as well as digital apps, and even potentially an AI assistant who can help be with you as you go through the process. And that's something that Fred and Svetlana and others are working on, and we're excited, and we're hoping to actually get a significant grant to further support those efforts. Haven't heard, but we're very optimistic on that. Education. Okay, so that's the clinical space. I'm going to move through these other important domains of ours in terms of our mission, because we are about training the next generation of psychiatrists and NPs and therapists and psychologists. We're big, now we have Putnam, the new advanced residency, 32 residents. Lennox launched this past July, South Oaks, hopefully next July. And you can see here, I haven't fact-checked this yet, but I think we may be becoming the largest department in the country in terms of certainly number of programs, but maybe in terms of total residents. We'll see. We're right now at a moment in education that I think is really, there's a lot of forces that are coming together and putting at the center of the conversation is how do we redesign medical education in a way that it's more outcomes based. So there's a lot of evidence to support that our current models produce graduates who have either are quite variable and to what extent they meet the competencies and skills required, or sometimes have inadequate skills. And there's lots of different studies and data that supports this. That's a different talk. But the focus is on what's called CBME, or an outcomes approach that really focuses on, there are two really key parts to this. One is a lot more direct observation and feedback and dashboards and coaching. And the other is individualizing the learning process and really making it based both on the interests of the learner, but also where they are developmentally. So we are fully engaged in that as a department. I am involved in this at a national level in terms of the conversations with the American Board of Psychiatry and Neurology that's considering moving into this space for actually continuing certification with the EPAs and outcomes and such. And then ACGME, et cetera. Lots of stuff happening right now. In this space are major revisions of the psychiatry program requirements going to start next year. And we're anticipating there can be some really significant changes at the national level. Now, here locally, we aren't going to wait for that. We're moving forward. Mather, Staten Island, Zucker actively designing, looking at our programs and designing to advance CBME. We've had some really good processes with Aaron and Jenna Taglienti, the program director at Mather, with Rashi and Anna Kostakis at Staten Island, and here with Mike and his team. We've got the new residencies, and then we have the NP advanced training program. Thanks to Tim Sullivan. We've got 3 NPs in there right now, and then we're going to be shifting to a new model, piloting a model, taking the lessons from Tim and piloting an NP fellowship, which will have be an official part of the Northwell ACP fellowship suite of options. We have Abby Konopaski, who has arrived from Dartmouth. She is an international leader in medical education research, focusing on agency, self-regulated learning, and then disability in the clinical workplace. She has 2 PhDs. She's a functional linguist, and then she also does a lot of work using mixed methods and qualitative methods, and has done work on critical race theory, theories of agency. She is just a remarkable addition to our faculty and to the health system. She'll be helping grow our program of education research here. We actually have had, in our first 2 months, we've got 3 grants submitted, and one of them is a nice $500,000 grant that is going to help support some of these efforts. And she'll be supporting faculty and trainees in terms of scholarships. So if you are clinical educator, resident, fellow, trainee, wanting to do scholarship, have a problem you're trying to solve, an abstract you're trying to write, she's will be available to you for support. And then the high school opened last week. You know, one of the 4 tracks, behavioral health, behavioral and mental health, we'll have 900 students by 2028. Don Shacknai, Vera have been really important in this process, representing us, along with at the highest level, Jason Nadich and Deb Salas Lopez. A lot of press about this last week. I think this is extraordinary. As a health system, we are thinking about workforce and workforce development in this way and going upstream like this. In the grants space, we've got nearly 14 million so far this year on what program and clinical grants. So not talking about research. Big shout out to Don Shacknai, who's been the lead on this. I think we've gotten over 40 million in the last 3 years, maybe something like that. Most recently, we got I think 6 different programs funded through round 3 of the New York State Centers of Excellence, which is roughly about 12.5 million. So that's going to allow us to actually build a number of clinics in Staten Island, as well as a citywide clozapine LAI program and other really cool stuff. So again, that's supporting our outpatient growth in a significant way. On the research front, Anil Malhotra, our vice chair and the director of IBS, has had an extraordinary last 18 months. I mean, we've been exceptionally strong for a long time, and this gives you a sense of the total value of grants over the last 4 years. But what's really incredible is the next 2 slides. In 2024, he and his group got over $28 million in new grants, total value. And you can see the folks listed here. A lot of these are R01s, NIH grants. And we're really proud of that. And then this year, we already have 20 million. And so that's amazing and growing. So I think Sunny Tang's the most recent to get an R01 announced. And I think we're Neil, you're optimistic that there could be a few more on the way, but not ready to announce. Nonetheless, terrific growth here and success. And you know, as we've mentioned in prior years, the MRI scanner is closer. It's going to be in the gym and renovations on that will start. Where's Arbor? Soon, soon. And we hope to have that thing installed in the next year. So next 12 months. All right. Community. We continue to engage with our partners in the community. We've got a coalition, behavioral health community coalition that Deb Salas Lopez started with Mike, myself, Manish, Don, Shakna, and others. Don and Manish have taken the lead. Really, the focus has been on Family Service League and CNG, and we can share more about, what's happening there, other contexts, but, working on things like access to clinical schedules, figuring out how we can get them onto Epic, building just ways that, patients who come through our ED or Access Hub might be better served by them, better served by us, but just trying to develop ways of collaborating and improving, getting care as close to where patients and their families live and want to receive the care. Global mental health has been, we're active in Ecuador, Guyana, and Ukraine. I'll focus on Guyana. This time, Lauren Hanna, who left the system this summer but had led this effort, done a terrific job, and now Khatija Paparwala has taken that role. Khatija, where are you, Khatija? There she is. And a lot of stuff here in the past year. We soft launched ketamine and ECT down at Georgetown after training, having their team come up here and get training with Sohag and his team, and Sohag and his team going down. And we're going to have an official launch next month, which will be really special. We've been providing different types of training experiences, including the residents coming here for several months at a time. The next type of activity there is we're having a team of their psychiatrists and clinicians come for a 2-week immersive training in addiction, substance use treatment. So, and Manasa, Brian Pritchard and Heather Sotiri, and others. I think Ashley Kunath, one of our 4th-year residents, has played a really important role in that with Jared Weiss. So it's really cool to see us leverage our expertise and desire to help and teach and train in this way. And that's a huge, Guyana has the 2nd highest per capita suicide rate in the country. They only had like 4 psychiatrists in the public sector until they started the residency in 2016. That's been a really important pipeline for them. They have very few people that train in substance use. And so this is going to be an important support to their health system. Ukraine, we've had a number of visits there over the last year, starting with Demir and Mayor, then Anna Kostakis, Yelena Zak, myself and Mayor, and then Mayor's been several times. Stress first aid, psychological first aid training for healthcare workers, clergy in the military, chaplains in the military. It's just something I'm really proud of our department, proud of Mayor and all the folks who have volunteered to be involved in this. I think it's something that has been really appreciated by the healthcare workers and healthcare leaders in Ukraine. A lot of uncertainty, obviously, with that context from a geopolitical standpoint, but we're hoping to continue our engagement and look forward to that. Nuvance has a remarkably strong, I say remarkable just because they're bringing a really strong global health academy and program that they've got partnerships in 8 countries already. They send residents on 6-week global health electives. They host global health scholars from LMICs to spend time in residence at Nuvance. And they have an Educators Without Borders program, which currently is supporting 55 faculty in different LMICs. So we're really excited about integrating our global health and global mental health efforts with them. We'll be presenting with them at the United Nations General Assembly later this month, and they'll be hosting a big 2-day conference up in Danbury next month, which we'll be at with them. Okay, so that's the department, state of the department in terms of what I have prepared for us. And I hope you have a sense of just the growth and the innovation that's occurring. It's impossible to capture all of it. And obviously there's a ton happening at each site that I'm not capturing, but this kind of gives a sense of across that continuum we're building, all the ways that we're growing and innovating, and also in research and education. What I wanted to end with is just a comment kind of coming back to, this time of threat and challenge is, I think it's going to be really important for us to yet attend to kind of these problems in the upper right, which we are and are really important around access, building the continuum, looking for ways to integrate, improving our operational efficiencies, coding, faster scheduling, all that. And these are, I think we have a really strong administrative team and clinical leaders that are going to lead this. At the same time, we need to pay attention to kind of what really undergirds all of this, which is our mission, our commitment to improving the care that our patients receive, especially those who are most vulnerable, and our commitment to each other. And that's where these soft, things come in, like joy, career development, purpose, meaning, belonging, our professional identity. And whatever we do, we need to solve for improving access and efficiency. We also need to be upholding and imbuing that with joy, purpose, meaning, and belonging. And that's no easy task. But having been 3 years in this role, and having gotten to know many of you and see firsthand all the things that we do, I am so blown away, inspired and grateful and humbled that actually we do this a lot of the time. Not always, and there's ways to get better, but I think we have it in us, and we were able to do this. And I think the key to really moving through these next couple of years is keeping focus on the mission and on each other. So with that, thanks everyone for listening, and we have a few minutes for questions, reactions. I'm sure you're all taking pictures of me, right? So.
When is the BPD to the
Okay, just wondering about when-ish the Behavioral Pavilion will be occupiable. When is that foreseen?
Oh, Arbor?
Yeah, so with any construction, right now, but if that's
So just for those online, the question was BHP2 here at Zucker, when will it be done? And Arbor is saying end of 27, maybe early 28. Thanks. Other comments, observations? Chris?
Thanks, John. Just quick question about the gym. Sorry, the gym closing down. Wondering if there's going to be another space opening on campus for patients to have a place to meet for things like ETP events, but which sometimes include some athletics.
Yeah. Is there, I think that's either, you could frame that as a question or as a problem we need to solve for, you know, so, yeah, Arbor?
We'll look at more.
Be the most, where would be the most, I guess, available and the most opportune space. The gym, unfortunately, was the one that could accommodate that we have not yet solved for a replacement for a gym or a place alike where patient or staff can utilize for many purposes. So as you know, real estate is at a premium here at Zucker Hillside. We're still looking, but there is not a close substitute at this point.
Yeah, I think, Chris, this is a good example of gains and losses. Yeah, it's a big gain to have the scanner. And is central to kind of what we're trying to accomplish. But that type of common space is scarce. And so that's a loss, and it's something we'll need to, it's not the best space for social events, you know, the acoustics and stuff, but it's a space and we don't have a lot. So we'll need to figure that out. Thanks for raising it. Others? Anyone online? The question? No? Okay. All right. So, Dr. Chang, you got a question at all? No? Clear as mud? All right. Why don't we, thank you everyone for being here and engaging with me on this. Let's transition to the faculty meeting and lunch. And let me just give you some instruction. What should they do?
For those faculty members who are staying, please just move to the sides. We have a lot more chairs than usual, so just be patient with us. Lunch will be set up shortly. And for those who are departing now, just make sure, please, and those who are still online, please make sure you do your attendance for today's session, either via the QR code. And then those who were here in person in our auditorium, please make sure you badge. If you have not badged in, please make sure you do so now as you exit. Thanks, guys.